afternoon, everyone. I'd like to call this meeting of the Senate Jobs and Economic Development, Finance and Policy meeting to order. Today is Wednesday, February 3rd, 2021. A quorum is present. Just a little housekeeping before we get started. Members, we have one bill in front of us today, and there is a lengthy list of testifiers. I'll have Senator Mathews, we'll start by adopting the Senator Mathews delete all amendment, and then he can begin his opening statements. We'll move on to testifiers. We're asking the testifiers to keep their comments to 3 minutes or less. I'd also like to ask the testifiers to stick around. I'd like to get through all the testimony before we have questions. That way one testifier may answer the questions that a senator was going to ask. So once we get through that list, we'll take questions. So before us, we have Senate File 1. Senator Rarick, would you like to move the A4 amendment?
Mr. Chair, I will move the A4 amendment.
Okay, the A4 amendment is a delete all authors amendment. All those in favor signify by saying aye. Aye.
Aye.
Aye.
Opposed? That motion carries. Senator Mathews, now that we've got your bill in the correct form, would you like to go ahead and make your opening statements?
Yes, thank you, Mr. Chair, and thank you to the members of the committee here. I'm honored to present this bill. I thank you for the chance to present it here. I have Senate File 1, which is a bill that I believe is a tool that we need now that we're going into 2021 and we're still in this recovery mode of the pandemic. I think that this bill is a big tool that we need to utilize to help balance the safety and precautions that we need to make sure that we can maintain everybody's health and safety and well-being in this COVID time right now, and try to help with the economic impact, which includes the impact on families, employers, employees, the kids, and all of the fallout that has happened in the economic impact as well. So Senate File 1, as we've amended, basically has two simple components to it. The first section of the bill will state that notwithstanding executive orders that are listed in there, a number that were issued throughout the year in 2020, a business will be allowed to open with no limitations imposed on them from the state if they develop and maintain a COVID safety preparedness plan for their business. And it has the items that are listed on there that many employers already keep in mind, but this makes sure that we spell it out here in statute. Health and wellness, social distancing, cleaning, sanitation, protection, operations and communications, both for employees and for customers that utilize their businesses. This also requires business owners to make a good faith effort to maintain safe and healthy workplaces and business operations. This will not allow agencies to impose additional penalties solely on the basis of executive orders. The second part of the bill will put a new requirement in that any executive order issued under the Chapter 12 sections under the Emergency Powers Statute that will close or partially close any business must be passed by the legislature with a 2/3 vote, and then also must give 14 days notice to business owners before it can take effect. And this is in response to many of the things that we've seen, many of the struggles that local businesses and employers and employees that got put out of work that encountered last year. And this is trying to find a balance between how we can make sure we maintain safe and healthy workplace environments, and that we can help keep as strong of an economic foundation moving forward for our businesses. This is also an attempt to give our small businesses especially some certainty to not have potential future shutdowns over their head decisions made solely in the executive branch. This allows for, if there are significant emergencies that are recognized, that these closures can happen if there is a large enough need and the people's voice is recognized through their legislature. But many business owners have expressed feedback to me that they know how they already had plans in place, that they weren't allowed to go ahead and open until the state came around and gave permission to do so, even though it was essentially identical to what business owners already had planned and put in place and ready to go. And this is to help give some certainty to make sure that they don't have large food orders come in, as we saw over the winter, extra orders placed for the holidays, and then suddenly another closure happened, and it ended up taking a large hit on business owners. So this is to give some more certainty, both on the decisions made and the time that they would need to prepare for some of these changes. So with that, that's basically the two parts of my bill, Mr. Chair. I want to thank you so much for giving this committee the chance to consider it, and I'd be happy to answer questions and turn it over to our testifiers.
Thank you, Senator Mathews. We'll do questions after we get through the testimony. Members, you should have received a letter from the Minnesota Chamber of Commerce on this bill, and so everyone should have that. But why don't we go ahead and we'll start with Mr. Chesek from the Licensed Beverage Association. Welcome to the committee. Just please state your name for the record and feel free to begin when you're ready.
Thank you, Chair Pratt, committee members. My name is Tony Chesek. I'm the executive director of the Minnesota Licensed Beverage Association. The MLB has been a nonprofit association since about 1953 and has proudly represented and become an educational resource for license holders. We represent bars, restaurants, and liquor stores. Our hospitality industry changed on March 16, 2020, when I received a phone call from the governor's staff alerting me to the fact that we're going to be shut down on St. Patrick's Day 2020. Since that time, the MLBA has been at the table. What I mean by that is MLBA has been asked to be a part of a group of industry leaders and experts to both communicate to our industry, but also provide important and influential information and data to the Office of Deed, Department of Health, and the governor's staff. We've done so very proudly. This group has been now called the Hospitality Roundtable Group that met weekly throughout the pandemic and most recently bi-weekly. From day one, our association's over 2,000 members reacted. As a hospitality industry, we do a lot of things well, but one thing we take exceptional pride in is keeping our staff and patrons safe. The members of the MLBA have listened to the mandate set by Governor Walz and the Department of Health and did our best to make a good faith effort to follow these to the letter. When we were asked to mask up, we did. When we were asked to post signage, we did. We were asked to develop significant and specific safety and preparedness plans. We did so with the understanding that we would be somewhat rewarded for what our efforts were. As an industry, we are taking this pandemic very seriously, so much to the point that hundreds of our members have gone above and beyond the call of duty to develop new and innovative methods to keep our people safe. Governor Walz said, to no fault of our own, are the bars and restaurants closed. If that's the case, then why are we still closed? I've reviewed the most recent contraction rates county by county and can clearly see that we are not in the space we were just a few months ago. With the vaccinations here, with license holders complying with the strict guidelines in place, the MLBA fully supports Senate File 1. Lastly, we took a poll about a month and a half ago, and about 1,100 respondents. 84% of those respondents said that they would be out of business within the next 90 days if there wasn't a significant dial turn. Minnesota, we are ready to be open for business. Chair Pratt and committee members, thank you for your time, and I'll hang out for a while and answer questions if you've got those, Chair Pratt. Thank you.
Thank you, Mr. Chesek. Next, we have Mr. Hickey from the NFIB. Welcome back to the committee, Mr. Hickey. Please state your name for the record and feel free to begin when you're ready.
Well, hi, Mr. Chairman. Am I coming through? I always have to ask.
Perfectly clear.
Good. Getting better as we go. Anyways, yeah, thanks for giving me the chance to make a few comments today regarding this bill. We want to thank Senator Mathews for bringing the bill forward. Our members strongly support. I'm with the National Federation of Independent Business, as many of you know, and we have over 9,000 members. Our members strongly support getting the legislature more involved in the emergency order process and law. The 201 members who have election certificates need to play more of a role, and hopefully that can happen somehow this year. This bill would do that in a big way. Many of our members have been hurt by closures, the closure orders. Hospitality, obviously the worst, and we're going to probably hear from people from hospitality, or we've heard from one person during the hearing. Hospitality resorts have really been harmed, but retail, a lot of small retail was harmed back in the spring. Fortunately, we went to half open in the summer, and now we're fully open, and that's really appreciated, and hopefully we don't turn back on that. Just based on my recollection of this emergency powers law, I've been around a while, that passed back in the 1950s. I can never recall it being near this controversial, and its scope and usage a lot more limited than what we've seen in a pretty extraordinary pandemic. The first time around in a pandemic for most of us. But it's clearly we need to get the legislature more involved in this process and of dealing with emergency power and the scope of it. And so anyways, we strongly support that goal, and this bill would lead to it in a big way. I don't know what the final answer is this year, but definitely need the legislature more involved. Thanks for the time.
Thank you, Mr. Hickey. Next, we have Mr. LeBeau. Welcome to the committee, Mr. LeBeau. Please state your name for the record, and then feel free to begin when you're ready.
Hello, I am Jeffrey John LeBeau. I've owned the Depot Bar and Grill in Faribault, Minnesota. John Zazinski is our senator, and the rest of the Republicans have done a wonderful job. Right now, we are in a struggling situation. Half capacity just does not do it. I normally feed 20,000 people a month. I've had this place 30 years. We've already had plans in effect for our customers' safety. We take that as the most priority. Right now, our employees are willing to come back, and they want to come back, and they want to do it in a safe manner. We're wearing masks. We're sanitizing daily like we've always done. We have the social distancing, the tables, and that kind of stuff. Right now, this has impacted the customers where when we did open up half capacity, they came back in droves, and they are doing to-go orders. So we've been pretty busy, which is fortunate. But right now, just doing half capacity is not enough. The people that are healthy, that don't have compromised immune situations, come out. The people that are maybe having situations, it might be an idea to stay home. But I think Minnesota people are smart enough to be able to make those determinations. My employees are more than willing to come back. Right now, they're having situations with their spouses, their kids, and that kind of stuff. Unemployment is just not cutting it right now. And I find the models from North Dakota, South Dakota, Wisconsin, Iowa, you know what? They're not bringing it to Minnesota. I mean, and they surround Minnesota. So we need to get this up and running. We're doing everything that we possibly could or can. The people of Minnesota truly want this. My customers are so thankful that we're open. Like I said, I'm fortunate. I've been a chef my whole entire life. I ran this restaurant ever since I was 23. I'm 55 right now. And my customers, I truly, I can't express how much support they've given us, but they want to come out. They want the social interaction, because right now, the toll of the anxiety, the mental health, I have a few people that are senior citizens that have lost their husbands or wives, but they come out because they want to have that social interaction. And you know what? And we're doing it. And we're taking really, really good care of them. And, I appreciate your time. And but right now, we got to get places back open. We have to, get Minnesota back open, back running. It's a bad virus. And I'm not sure what the new norm is, but we've had a flu shot, for as many years as I can remember. Maybe we're going to have a COVID. shot in the near future. I have no idea, but we deal with diabetes, we deal with cancer, we deal with all these other things. And right now I know we're talking about COVID and it is horrible, but we need to figure this out in a logical way. I appreciate your time and thank you very much.
Thank you, Mr. LeBeau. Next we have, and it's, please correct me if I mispronounce your name. Is it Miss Hummel or Miss Hummel Fox?
Hello, it's Hummel Fox.
Okay, Miss Hummel Fox, please state your name for the record and then please feel free to begin when you're ready.
Thank you. My name is Terry Hummel Fox. I own Gianni's Steakhouse in Wayzata, and we've been in business since 1997. I'm a member of the Hospitality Minnesota as well as the Governor's Roundtable for our industry. On November 18th, I had to call all my staff together and tell them that we were closing the restaurant and I had to lay them all off. 49 souls work for me and look to me to provide a living for their families. I felt so awful. There wasn't a dry eye and I couldn't tell them when they were coming back. I did promise them when we opened, they would all have their jobs back. But was even scarier and even tougher for me was knowing that the unemployment benefits were about to run out and CARES money was gone. Right now, they're suggesting that possibly as many as 50% of the restaurants in this state will not survive. And of the 50% of that do survive, another 25% probably won't make it till the second quarter unless we open our businesses again. And we have to open our businesses. The restrictions are so negatively cumbersome that it's impacting us in a way that we can't continue to operate this way. 50% capacity, no more than 2 people at a bar together, tables of 6, and they cannot come from any more than 2 families. I mean, I'm almost at the point to wonder if I have to drop off a DNA kit with the menu. Curfew at 10 o'clock. With 50% capacity, we're trying to get early seatings and late seatings, and at a 10 o'clock curfew, we lose a whole seating at the end of the night because people have to be out by 10 o'clock. With the last executive order, the regulations for social and private dining is 8 pages long. I mean, it's just too cumbersome. So here we are, and where do we go? What do we do next? We have to open our businesses. And I'm going to scream as loud as I can, and collectively with every hospitality business owner in this state, we have to open. So for us to open up and maximize this opportunity, there's just a couple of bullet points that I would suggest. 1, keep it simple. Take away all the rules and regulations. If there's anything lingering, keep it simple. 3 bullet points, like wash your hands, social distance. Eliminate all vocabulary that's specific to capacity. Just remove that from our vernacular. We should be able to open up with no restrictions for capacity of any sort. The other thing I believe is that we have to find a way to separate bars and restaurants into 2 distinct categories. And the reason that I suggest that is if we did have to turn the dial and one of those 2 industries was more egregious than the other, it's easier to do. It's also been suggested to me that people can't figure out how to determine what's a bar and what's a restaurant. We submit our sales reports to the state every month, and we clearly label what's sales for liquor and what's for food. If your liquor sales are over 50%, you're a bar. Under 50%, you're a restaurant. I think it's super, super easy. Lastly, the thing we have to have is transparency for the facts that are being used to shutter this industry, because it does not make sense. Less than 1% of all positive tracing can be put back on our industry. And yet the state has closed an industry that employs hundreds of thousands of people that are now unemployed. It just doesn't make any sense. We have to have transparency. We have to understand what metrics they're using to close us. In closing, all I can tell you is that our industry, let us be the protector of safety practices for our staff and for our guests. Let us be the promoter for best practices, making sure that things are clean, making sure that the tables are socially distanced. Let us open our businesses.
Thank you very much for that. Next, we have Mr. Harrington. Welcome to the committee, Mr. Harrington. Please state your name for the record and feel free.
Thank you. I'm Ray Harrington from the St. Cloud area, own 4 restaurants, bars in the area, and the company I work with, we all together own about 25 in the state of Minnesota. Back in November, my son came home and was tested positive for COVID. So when MDH called, I got on the line and listened in. And the very first question that they asked was, what bars and restaurants you've been to? They didn't really want to hear that he spent an hour picking out paint at Home Depot or 45 minutes looking at pillows at Home Goods. That wasn't an issue for them. They just wanted to make sure they pinpointed the restaurant business. It's very disheartening to hear those kind of questions that they can manipulate and create their own data that is really not accurate. I have a graph here. I don't know if you can see this. No, I missed it. It's a graph that shows all of the cases per 100,000 for Minnesota and its surrounding states. And if you've all seen that graph, it's all the same graph with that bump in Thanksgiving and a little bit at the beginning of the year, and it just drops off. All the states around us are at the same exact graph, but only one of those states laid off families over the holidays and put small business in danger. And it did not manipulate the graph any different than it did in the surrounding states around us. That's living proof that we need to make sure that we're making these right decisions, and the legislative body is doing that decision-making and not the governor and the small group that he uses around him. It should be something that's done for the people that we, through the voting booth, hired to do that job, not a small bubble of people. We have been doing everything we can, just like the other people testifying. We take temperatures, we take reservations still. People think we're crazy. 6 feet apart. We have a preparedness plan in place in all of our stores. We have 2 copies of it, one out front for anyone who wants to see it, and one in the office so we can actually use it when we need it to. So we've done all the things that we've been asked to do, and we've gone above and beyond all of those requirements to make sure both our staff and our customers are safe. What I'm asking out of this bill is that the legislature starts doing their job, that they're the ones responsible for making rules and laws, and that they exercise that right and not leave it to a small group of people who all think alike. It's very important for us to get open for our survival, for our staff, for the sanity of our communities. We need your help. So I really hope that you vote the right way, or the discussion goes in the right way for this bill. Thank you.
Thank you. Do we have Mr. Morris? Did he ever join? Okay, we don't have Mr. Morris. Next we have, please correct me if I mispronounce your name, Ms. Guerin. Welcome to the committee. Please state your name for the record and feel free to begin with when you're ready.
Okay. My name is Janice Quinlan Guerin. Can you hear me okay?
Yes.
Okay. My husband and I own 2 businesses, Doc's Landing in White Bear Lake and Quinny's Sports Pub in Matamidi. They're 2 neighboring communities. Doc's Landing, my husband purchased in 1988, and in 2018, we purchased Quinny's, which was the former Jethro's, for 40 years. So it's kind of a fixture in the community. So we've spent a ton of money to comply with the mandates. Besides all the masks, we've done filtration with the HVAC, products for customers. We've even hired out private companies for to come in to do some intense disinfecting. Doc's Landing, we're down about 65%. We cater to the service industry, and they sometimes do not get off until about 10, 11 o'clock at night. So the 10 o'clock closing is what's really killing us. Quinny's, we're about 50%, and it kills us mostly for, I would say, Friday and Saturday evenings, because that's when we make up all our money. And so if we can't get more than 50%, and then we're going the wrong direction. What we see is the inconsistency in our government. they keep changing the rules on us. You know, I've heard lately that the PCR tests are too sensitive, and you know, is the previous data based on flawed data, our decisions? So I've personally spoken to a lot of people who, just like that other gentleman said, they've tested positive for COVID, and they were grilled on what bar and restaurant they went to, yet they don't talk about going to Target and Cub and places like that. So I get it that in restaurants and bars, you get to take your masks off, and because you have to eat and drink. But at this point, what do they know? Now they're saying 2 masks is what is needed. When are we going to get to 3 masks? I'm just curious if that's going to be the new norm. And I really think that the government is fooling themselves if they think they can control people. Because look at us, we're on the border pretty much of Wisconsin, and all those people are going over to Wisconsin and coming back here. So they're not going to be able to control people. And it's, as a business owner, we know best. We want to take care of our clientele, because we're not going to be open if we do a lousy job. We're going to close anyways. And this financial burden that we're putting on, that we're being forced to put on, and how it affects our employees. My employees, there's some that I haven't been able to call back, and the ones that I have been able to call back, they're not making as much money, and it's very disheartening to them. I think we need to give people in the community a choice if they want to go out to the restaurants and bars. If they're that afraid, they can stay home. And for what we see, most of America, it's a 99.9% recovery rate. But I think you're seeing a lot of people hearing things on the media, so they won't go out to the restaurants. So by mandating a 50% maximum and closing at 10 o'clock, it has so many people fearful. I talked to a woman who said that she's not ready to go to a restaurant yet. And I haven't heard of many people coming to my restaurant that said, yeah, I got COVID and I was at your place. I haven't heard of any. So let's give people a choice. And I appreciate you letting me speak today. And I hope we get this passed through. I don't know if if in the end, if it's Governor Walz who has to sign the bill. So then we're kind of going down a dead end road, but at least we're getting the word out on this. So I thank you for that.
Well, thank you, Ms. Quinlan Guerin. I appreciate your testimony. Members, we're going to change up the order just a little bit. We have our next testifier has a commitment at 4 o'clock. So I want to make sure that she gets a chance to testify. And then we're going to break protocol, allow members to ask her questions if they have any, so that she can make her appointment. Please correct my pronunciation if I mispronounce your name. Is it Ms. Lourdes Tapia and her interpreter, Nadia Smith? Welcome to the committee. Please state your name for the record, and then please begin your testimony when you're ready.
Thank you. My name is Lourdes Tapia.
Yes, thank
Okay.
you. My name is Lourdes Tapia.
Buenas tardes. Yo trabajo durante acerca de 7 años en limpieza en las oficinas de Ameriprise en el downtown de Minneapolis.
Good afternoon. My name again is Lourdes Tapia, and I work cleaning the offices of Ameriprise for about 7 years, and this is in Minneapolis.
Trabajadores como yo hemos sido llamados esenciales durante la pandemia. Eso significa que no hemos podido trabajar desde la casa como otras personas. Eso también significa que mis compañeros de trabajo, personas inmigrantes y personas de color, formamos la mayoría de los trabajos esenciales y estamos en un riesgo más alto de contraer COVID.
Workers like me have been called essential throughout the pandemic, which means we haven't been able to work from home like other people. But that means my coworkers and I, as well as immigrants and people of color who make up as many as the essential jobs, have been at greater risk to get COVID.
En el edificio donde trabajo, somos alrededor de 18 personas en el turno de la noche. En el verano pasado perdimos a un compañero por causa del COVID. Y en el otoño pasado, 2 compañeros estuvieron intubados por 2 semanas. Desde el principio de la pandemia, más de la mayoría de nosotros hemos tenido que hacer cuarentena, aislándonos de nuestras familias para mantenerlas seguras y no continuar la transmisión de COVID en nuestras casas, comunidades y trabajos.
At work, we're about 18 people. At work, we were about 18 people this past summer, and one of my coworkers passed away due to COVID. And this fall, 2 of my coworkers had to be intubated due to COVID. Since the beginning of the pandemic, more than half of us had to quarantine, isolating ourselves from our families to keep them safe in order to not to continue the spread of our house and our households, communities, and work.
Lo que están proponiendo hoy de abrir sin responder los problemas que han causado que muchos de nosotros nos enfermemos no es correcto. Nosotros necesitamos que ayuden a las personas que han arriesgado su salud para que la economía continúe.
What you're proposing today to just open up without addressing the issues that have caused so many of us to get sick is wrong. We need you to help people who have risked our health to keep our community running.
Todos queremos que el COVID pase, pero ignorando lo que la mayoría de nosotros estamos enfrentando. Volviendo con prisa y sin apoyo significa que más personas se enfermarán. Habrán menos recursos en los hospitales y que más personas van a morir. Necesitamos que la cuarentena sea pagada y otros apoyos para que la gente esté segura y podamos llegar al punto donde podamos abrir seguramente. Si hacen esto muy rápido e ignoran las voces de los que hacen el trabajo, más gente morirá.
We all want to get past COVID, but ignoring what so many of us are facing and rushing back without support will mean more people would get sick, less hospital resources, and more people will die. We need paid quarantine time in order to support us so people can be safe and we actually can get to a point where we can reopen. If you rush this and ignore the voices of those who are doing the work, more people will die.
Nadie debería de escoger entre la salud y un salario. Espero que mientras hagan su trabajo nos mantengan en cuenta y no nos traten sin consideración. Gracias.
No one should have to choose between our health and our paycheck. I hope that as you do your work, you keep in mind to all of us who are doing the work and don't treat us as expendable. Thank you very much.
Thank you. And then we'll just break the protocol here for a little bit. Do we have any questions for Ms. Tapia?
Como la señora Tapia tiene que ausentarse porque tiene que ir a trabajar, ¿hay alguna pregunta para la señora Tapia por parte de los senadores y representantes?
Ms. Tapia, I just want to, in some ways, agree with you. We agree that the COVID virus is extremely important and serious.
Señora Tapia, de todas maneras, yo de alguna manera estoy de acuerdo con usted, porque sí, es cierto, entendemos que COVID es bastante peligroso, extremadamente peligroso.
And we certainly don't want to rush back to work and put employees or the clients at risk of contracting COVID.
Sí, seguramente no queremos apurar y abrir y poner en riesgo a los empleados y a los clientes en riesgo de contraer COVID.
As an essential worker, have you seen steps that your employer has taken to protect you and your customers?
¿Usted como empleada ha visto algunos pasos que su empleador haya tomado para protegerla a usted y a sus empleadoras?
En el lugar en donde trabajo, sí. Tenemos desinfectante, guantes, mascarillas y siempre están dándonos charlas acerca de la protección de nosotros y de las personas que trabajan en el edificio.
At the workplace that I am, yes, indeed, we have masks, disinfectants, and some other things, and also some information on how to protect ourselves and how to protect others that are in the building.
Excellent. And that sounds very close to what Senator Mathews is proposing. So thank you.
Y es excelente porque parece muy parecido a lo que Sarah Mathews está proponiendo. Muchas gracias.
Do we have any other questions for Ms. Tapia? I see Senator Herr and then Senator Draheim.
¿Hay alguna pregunta para la señora Tapia? Vemos a la senadora Herr y a otro senador. Vamos a ver el nombre.
Senator Herr.
Senadora
Thank you,
Herr.
Mr. Chair. Thank you,
Senador
Chair.
Herr.
I don't have a question, but I would just want to express my appreciation for Ms. Lourdes to come and testify. So this will help me if I ask any question later. Will shorten my explanation because she explains all very much of the people that we represent and people who are our essential workers. So that, thank you for being here to explain pretty much the larger scope of thing and the disproportional of data that we are facing right now. Thank you.
So, más que todo, agradecer a la señora Lourdes por venir a testificar y lo que nos ha informado de veras nos pone en evidencia la necesidad de las cosas que están pasando y también sobre la información y los datos que hemos recibido. Muchas gracias por acompañarnos.
Thank you, Senator Herr. Senator Draheim.
Excuse me, and I'm sorry, I missed the name again, sir?
Senator Draheim.
Senador Graham.
Yeah, my comment is more towards the whole group and not one particular testifier, Chair.
Mi comentario es para todo el grupo y no era en particular para nadie que ha testificado específicamente.
Thank you, Senator Draheim. Then would you like to hold your question till the end?
Entonces,
Yes,
¿quiere
that'd be great.
esperar su pregunta hasta el final? Sí, así lo haré.
Senator Mathews.
Thank you, Mr. Chair, and I just want to express my thanks as well to Ms. Tapia for coming and sharing. And you are absolutely right, and we need to make sure that this is done in a safe way for workers to make sure that we can be back at work and done safely. So thank you so much for sharing your testimony, and I will take those very seriously as we move forward with this legislation to make sure that this is done right.
Sí, más que todo agradecer a la señora Lourdes Tapia por su presentación y es cierto lo que ella dijo. Vamos a asegurarnos que a la hora de aprobar esta ley de apertura se hace también protegiendo a los trabajadores y cubriendo las necesidades de su salud y su seguridad. Muchísimas gracias por testificar.
Okay, do we have any other questions for Ms. Tapia?
¿Alguna otra pregunta para la señora Tapia?
Okay, seeing none, Ms. Tapia, are you welcome to stay for as long as you can, and we're going to continue on with the agenda.
Viendo que
thank you
nadie
very
más tiene alguna pregunta, usted puede es bienvenida de quedarse o irse cuando usted necesite. Muchas gracias.
Thank you.
Next, we have Assistant Commissioner Huff from the Department of Health. Welcome to the committee, Mr. Huff. Please state your name for the record, and please feel free to begin when you're ready.
Thank you, Mr. Chair. My name is Dan Huff. I'm one of the Assistant Commissioners at the Minnesota Department of Health. The stay home and stay safe measures, including closures and capacity restrictions, have been an important tool in Minnesota's response to this pandemic. We oppose this bill because it would effectively remove these critical tools in Minnesota's response to the pandemic at a time when new, more contagious variants have emerged. 2020 has been Minnesota's deadliest year. However, the data indicate that it could have been much worse. For example, if Minnesota had the same death rate for COVID as South Dakota, over 4,000 more Minnesotans would have died. The mitigation measures implemented by Governor Walz this past year have saved lives, prevented disease, and protected critical healthcare capacity. These measures are in line with the majority of states and multiple countries and are supported by the scientific literature, our own data, and our own experience from this past year. Specific demographic populations cannot be walled off or placed in a bubble from a highly infectious virus circulating widely in the community, such as the case of SARS-CoV-2, the virus that causes COVID. What happens in one sector of our state, be it in a gym, a bar, a restaurant, or other businesses, spills over to the rest of our community, including those who are most vulnerable. At the same time, we know that the impact of the pandemic has been great upon our businesses. And this is why the administration's pandemic response has maintained its focus on the state's economic health, the well-being of all Minnesotans, in addition to following the public health science to control the disease and limit disease and death. This bill presents a dangerous shift and would go so far as to prevent even the more limited measures in neighboring states like Iowa and North Dakota. None of these decisions have been easy, but as compared to our neighboring states, our response to the pandemic has saved thousands of lives here in Minnesota. While we oppose this bill, we look forward to working with the legislature to partner in responding to the pandemic. Thank you.
Thank you, Mr. Huff. Next, we have Ms. Heising. Welcome to the committee. Please state your name for the record and feel free to begin when you're ready.
Good afternoon, Mr. Chair and members of the committee. Thank you for allowing me the opportunity to testify today. My name is Melissa Heising, and I'm Legislative Director for the Minnesota AFL-CIO, the state's labor federation of more than 1,000 local unions who represent more than 300,000 working people throughout our state. I am here to speak in opposition to Senate File 1 as amended because it removes safety protections for workers in the middle of a pandemic and puts working people of color and Indigenous workers, particularly women, at the greatest risk. A recent study by the Center on Women, Gender, and Public Policy at the Humphrey School found that women, and particularly women of color in Minnesota, are more likely to work in high-risk essential jobs with greater risk for exposure to COVID. About 40% of Asian women, 37% of Native American women, and 30% of Somali women in the workforce fall into this high-risk category, according to the report. Senate File 1 as amended allows businesses to operate with no capacity limitations and no penalties for violating executive orders. It says they must have a COVID preparedness plan and make a good faith effort to maintain a safe and healthful workplace with no enforcement. Working people know from experience during this pandemic that some employers have not always complied with executive orders, even with the enforcement mechanisms that are currently in place. We have received countless reports from workers in industries across the state that their workplace does not have a COVID preparedness plan or has an inadequate plan, has not sought worker input on the plan, has not offered training or enforced compliance with the plan, has provided no PPE or inadequate PPE, lacks cleaning supplies and disinfection practices, is not conducting temperature checks, is not enforcing social distancing, is requiring workers to come in when their jobs can be done from home, is not offering paid time off for workers who need to quarantine, is not offering reasonable accommodations for workers with an underlying health condition or a family member with an underlying condition that puts them at higher risk for serious illness or death if they contract COVID. And in public-facing workplace settings, we have heard many reports of customers who refuse to wear a mask and verbally abusing employees. Again, this has all been occurring even with the executive orders that are currently in effect. If this bill were to pass, employers could ignore their preparedness plans with no consequence. Removing enforcement and penalties would only make this problem more widespread and put more workers and their families at risk. While vaccines are underway, the pandemic is not over, and we are seeing the emergence of new strains we know little about that are more contagious and possibly more dangerous. Workers in industries across Minnesota continue to be concerned that their workplaces do not adequately protect them and their families from COVID-19. They need increased enforcement of workplace protections in the executive orders, not the elimination of enforcement. We respectfully request committee members vote no on Senate File 1 as amended. Thank you for your time.
Thank you, Ms. Heising. Members, that is the list of testifiers, unless we've had Mr. Morris sign in. And I don't see him. So we'll go on to questions. Senator Draheim, we had your hand up first, and then we'll go to Senator Champion. Senator Draheim.
Thank you, Chair Pratt. And, just a few comments, and then I have a question for Assistant Commissioner Huff, if I could. But, just so people know, I had a restaurant for 13 years. I had 65 employees. They're family. And I know most of the testifiers will probably say the same thing, that they care about their employees. And, I still have an event center. I'm still shut down. I'm not fortunate enough, like these restaurants, to be open because the government says I can't. But we have a plan, and we talk to our employees about our plan. They help develop the plan. They help develop the cleaning protocols. I think most of the employees or employers on this call would agree that they would let their employees off if they needed time off, like I would. They care about their employees. It's a really tough job market out there to find employees, that is. So from an employer standpoint, we want to do everything we can to keep our employees. And that means we'll bend over backwards to try to make it work for them to be able to work and have the protection that they needed. Most of us spent thousands and thousands of dollars trying to protect our employees and try to operate as safe as possible. But I guess my question, Chair Pratt, and thank you for letting me ramble a little bit, to Assistant Commissioner Huff is, I talked to you earlier in the week about the definition of an outbreak when we were talking about masks for kids' sports. Just wondering if you have your definition for an outbreak, and has that changed?
Mr. Huff.
Mr. Chair, Senator Draheim. So outbreaks are defined differently in different sectors. We look at it both, the purpose of defining an outbreak is, do you have a cluster of people that are all in a similar location or the same place over a certain amount of time, and they don't have other places, or they're not from the same household or the same workplaces, that would have said that they would have all come together and been exposed. So for example, for restaurants and bars, we look at 3 or more cases that are from different households that were both infected who visited the same restaurant or bar over a 2-week period.
Senator Draheim, you had a follow-up?
I do, thank you, Chair. So how many different sectors do you track? And what are the definitions for each sector? And do they all have the same time frame?
Mr. Huff, when you're ready.
Thank you, Mr. Chair. Senator Draheim, I don't have that information for every sector and every criteria, but more than happy to provide that for you as a follow-up.
Okay, and then the follow-up from the mass discussion too, on the average size of the outbreak, matching the size of your definition of an outbreak for that category, which I believe was 5 for the kids' sports. That would be great. Thank you.
Thank you, Senator Draheim. Next, we have Senator Champion, followed by Senator Rarick and Senator Putnam. Senator Champion.
Thank you, Mr. Chair. I have a couple questions, and thank you to everyone who provided testimony today. So I'm going to start off with a couple questions for Senator Mathews, if that's okay. Senator Mathews, are you aware of a letter that was written to the legislative leaders from the governor, both on January 7th 2021, as well as on January 21st, 2021, where the governor expressed a desire to try to wind down the executive orders and was seeking for the legislative leaders to come together to put a number of protections in statute. Are you familiar with that letter? And did you have a chance to read that letter?
Mr. Chair and Senator Champion, I am definitely aware of the first letter that came out at the start of session. I'd have to double check dates off the top of my head. I'm not sure about the second one you're referencing, but if it's of the similar fashion to the first one, yes, I'm aware generally of the, I did read the first letter and I'm aware of the general request from the governor.
And so that would suggest that you're aware that the governor has been trying to work with the legislature in many different ways. I've heard one of the testifiers, talk about a desire to have the legislature more involved in emergency or peacetime emergency declarations. Senator Mathews, are you familiar with Chapter 12? And if you are, can you tell me what it currently outlines as a way for the legislature to be involved in any peacetime declaration that is put forward by the governor?
Mr. Chair and Senator Pratt, yes, unfortunately, we've all become better experts on Chapter 12 in the last year than we've wanted to be. And I do think that we perhaps have differing definitions of what working together actually means with regards to the letters that you're referencing. I'm not sure that a list of do exactly as I say, and then I'll give this up meets what I would define as working together. And that tends to be what is often the case to most people in most every industry around the state for how two sides differing need to come together to a final conclusion in moving something forward. So we probably have different definitions of what working together actually looks like. As to Chapter 12, yes, there is the provision you're likely referencing, the vote by the legislature. That provision amounts to a legislative veto, which has been found unconstitutional by the US Supreme Court. I do think that we need our statutes updated to reflect that it should be a proactive measure of allowing the legislature to come in and proactively extend executive orders and emergency powers if they are still necessary, rather than being held back from stopping them unless those legislative vetoes get enacted. So I'm familiar with that. They are out of bounds with the Constitution at this case, and we're working hard to remedy them. I know one of my good colleagues, Senator Osmek, has a bill that would do just that, and hope that we would get bipartisan support on that as well.
Mr. Chair, if I can continue asking a couple questions. This question I would have.
Senator Champion, also to let you know that the next stop for this bill will be state gov. So many of the questions you're asking will be addressed there.
Okay.
So as much as we can stay on the business piece and the jurisdiction of this committee, I would appreciate it. But I will give you some latitude because this is the committee of origin.
Okay, I would certainly do that. Thank you, Mr. Chair. And I want to make sure that I adhere to your request. Ms. Fontaine, can you tell the committee if Chapter 12 has been deemed unconstitutional?
Ms. Fontaine.
Mr. Chair, members, Senator Champion, I'm not aware that it's been deemed unconstitutional.
Okay, thank you. I thought that would be important because the author has said that it's been deemed unconstitutional, and I would hope I would hope that we would not put things out in the marketplace that are untrue. So, because I want to concentrate on the business aspect of this. Senator Mathews, from the business side, is there? Tell me how you're defining good faith, because it looks like on line 1.15 of the delete all amendment, you talk about something being of good faith. Can you outline how you are defining good faith?
Mr. Chair and Senator Champion, thank you for the question. I believe that good faith is usually commonly defined as putting an actual effort in that is intending to accomplish the goals that it's setting out to be, not a feign attempt that is easily identifiable as a farcity with no real intent of accomplishing the objective. As applied here, I believe that it would mean business owners will put upon themselves, if they are going to meet this law and be in compliance with this statute, would put in actual genuine efforts to have a strong safety plan in place to make sure that those protections are adequately in place, and that we overcome some of the negative examples that we heard from some of our testifiers here. Apparently, there are some that aren't acting in good faith. I haven't met one yet in my district and in other areas around the state, but I would believe that it would be a genuine and strong effort on the behalf of business owners to make sure that strong safety plans are in place.
And Senator Mathews, who would look over those plans in order to make sure that they line up with the intended purpose in order for you to conclude that anything that a business owner has done has been in good faith? Can you talk a little bit about oversight and who's going to look over those plans in order to make sure that they truly line up with what you say?
Yeah, thank you, Mr. Chair and Senator Champion. This doesn't negate any of the other health codes that are in statute, any of the other business workers' rights codes that are in statute. This solely goes to the efforts that would be made through executive orders. So I believe that all of the measurements to make sure that there are food safety, health safety, all of those things would not remain changed. Mr. Chair, I'd also wonder if any business owners wanted to give answers from their perspectives as to how this would impact them in answer to the question as well, since I've not been a restaurant owner myself, but I do believe that they would have experience to weigh in on the question as well.
Mr. Chair, if I might, I was asking the author because the author is the one who has put this forward, and I'd like to know what he thinks because he's the person who put forward the policy. I'm sorry, go ahead, Mr. Chair.
Thank you, Senator Champion, and I didn't want to interrupt you. My apologies. But, I will remind the committee that the Department of Labor has established guidelines around COVID preparedness plans, that they must have them on site and available for inspection, but they are not required to get them approved. And that won't change under this law. So to your question, who would have oversight? It would be the Department of Labor under the current conditions that they already have oversight.
And Mr. Chair, and one last question, and then I'll get out of the way and let some others ask a question. And this is to Senator Mathews again. Senator Mathews, you would agree that an emergency is defined as unforeseen combination of circumstances where it's an emergency. It's not something that can be planned. Would you agree with that definition? I got it from Webster's, so I would want to know if you line up with Webster's first of all.
Mr. Chair and Senator Champion, yes, I believe that's a generally acceptable definition. I would agree with, yes.
And if that's a generally acceptable definition, so tell me how you arrived at 14 days being a requirement for notice to be given, especially if an emergency arose, and that there be this requirement that 14 days, and even if the governor came up with an executive order that provides an opportunity for the legislature to chime in, can you sort of tell us how did you come up with the 14 days and how did that line up with being defined as an emergency act? Because now you are undermining the governor's ability to deem something an emergency and to react on behalf of the citizens.
Mr. Chair and Senator Champion, thank you for the question. We landed on 14 days out of response to how the situations got handled last year, particularly in November when this pandemic had been going on for, if my math is right, about 8 months at that time. So I don't think it would meet the definition of unforeseen and unexpected as you indicated. And the businesses were given, I believe they can correct me if I'm wrong, about a 2 days notice that they were now required again to shut down. And this was after many of them had made large purchases for the holidays. And that causes a lot of trouble and turmoil. And I know in the metro area, that they can more easily shift to online orders, to go orders. Customers are very close by, can come out the door. I heard from a number in rural Minnesota and in small towns that I represent that don't have those systems and apparatus in place. And so the only response that was left for them was simply close all the way. There was no takeout or order out delivery system that they could pivot to. So the business owners definitely need some measure of time in order to respond to that. I'm definitely open to a day other than 14 that's named here if there's a genuine effort to try to get a proposal like this all the way along. But I do know that how it was handled last year with, I believe, 2 days notice became extremely problematic for a number of small business owners.
Mr. Chair, I said I had one last question. I promise this is my last question, and it's directly tied to liability. So, Senator Mathews, would you be open to including in this bill that business owners should be liable for if employees get sick as a direct result of a faulty plan that did not keep them safe? Because I heard you saying earlier how you believe it's important for employees to be safe and then for businesses to be able to open, and you want to open it back up, notwithstanding some of the health challenges, but you want to put it on business owners to make decisions about whether they should open or not. Are you open to liability being placed on businesses, especially if it's their decision and it's their plan?
Mr. Chair and Senator Champion, I'd have to give that some thought, and we'd have to make sure that there was a system in place that actually proved that it was the business that was liable. We heard from testimony here that the cases are extremely low, and so they can't be used as an excuse for that. We definitely we aren't looking to excuse explicit and outright wrong behavior, but I don't believe that represents the vast majority of our bars and restaurants and our small business owners. So I can't promise a yes right now, and I'd have to see exactly what that language would be, but it's definitely something we can talk about.
Mr. Chair, thank you so much for engaging me. I appreciate it.
Thank you, Senator Champion. Next, we have Senator Putnam, followed by Senator Herr, myself, and Senator Draheim. Senator Putnam.
Actually, Mr. Chair, I think Senator Rarick was before me.
I think you're right. I forgot to write him down. Senator Rarick.
Thank you, Mr. Chair, and thank you, Senator Putnam. A couple quick comments, and then I'm going to have a question, and I'll have a couple more comments. The one thing I guess I want to just make clear, my understanding of the bill and my reading of the bill is that this is supposed to be helping businesses that were shut down through different executive orders to be treated more like the businesses that were considered and deemed essential and have been open and running during this entire time. And we have not seen an outbreak in these other businesses that were allowed to be open. And so we had some testimony opposed to this bill that actually was mostly aimed at what has happened with businesses that have remained open during this time. So I hope people keep that in mind as they think about it, that, you know, we're talking about a bill trying to help businesses be open that have been closed so that they can survive. I don't think they're looking for handouts. They're looking for a way that they can be open and take care of their customers, take care of their workers, and be able to once again thrive. the one question I would have for the assistant commissioner, during these closures, we heard over and over the theme that this has to be done to protect people, and that these businesses and the people that work there and that own them need to tighten their belts and work through this to help people. And so I guess my question would be, is the Department of Health doing the same thing and going to come to the legislature with ways that they're going to cut their budget and tighten their belts like businesses have been asked?
Mr. Chair, Senator Rarick, I will say that members of the Department of Health have tightened their belt in many ways this year, in not spending time with family, not having much in the way of time off, working well beyond their normal work days. As far as the budget, I would say that we support Governor Walz's budget. We are always more than happy to come and discuss what our budget is, how we might make changes in that. But at this time, I'm not prepared to speak to our specific budget as outlined in Governor Walz's proposed budget.
Thank you, Mr. Chair. And I guess I would say, when I look at the folks who are on this call who run these facilities, they spend a lot of time away from their families in order to make these businesses run. Coming from the construction industry, especially folks who work on road work during the summer, they spend tons of time away from their family. So that to me is not tightening your belt. Sorry, Mr. Assistant Commissioner. That was, I think, a terrible answer. But the one thing I want to address in this, I've been looking at a lot of different statistics, and I apologize to the committee for not being able to get this out to everyone ahead of time, but I've got a graph that was put together, and it shows, what it's showing is the states, all 50 states, whether they did very few restrictions, whether they did very high restrictions, and how that compared to the number of deaths per 100,000 people. And it was brought up about how South Dakota had a higher rate than we did. But you could pick out Arizona, Pennsylvania, and New Mexico, that if we had the same rate of death, that we would have had far more deaths in Minnesota. But those three states had higher restrictions on businesses than Minnesota did. This chart shows that we have a sector of states that did very high restrictions and still had a high number of deaths per 100,000. We had states that did very low restrictions and had a very high number of deaths per 100,000. And then on the flip side, states that did very few restrictions, it shows both ways. So ultimately what this is showing is that the restrictions on businesses had very, very little impact on what truly happened and what caused the death rates. And let's be honest, almost 90% of the deaths in Minnesota were in long-term care facilities and in people who were 65 years and older. That basically has nothing to do with the businesses that we shut down through these executive orders. So members, I hope we really think about this and say, what are the true impacts that we have had, and what have we done to certain businesses along the way? We've seen some businesses thrive and boom through this because they were deemed essential. And yet in all of that, we saw no spikes, no problems necessarily within those industries. And I think it is only right to allow other businesses that same option to be able to put in place a plan to keep their customers safe, to keep their workers safe, and keep their businesses open and alive. Thank you, Mr. Chair.
Thank you. We have Senator Putnam, Senator Herr, then myself. And if we have time, we'll go back to Senator Grayheim. So Senator Putnam.
Thank you, Mr. Chair, and thank you to everyone who testified today. Additional thank you to Senator Pratt for conducting this hearing fairly. It's nice to hear both sides of an argument in the context of a hearing, and for all of us for participating in it with adequate civility. This is an issue that has become, I think, unfortunately politicized in ways that none of us are well served by. No one here, no one in the entire state of Minnesota wants anyone else to get sick. Simultaneously, no one wants anyone to go out of business. And I think that that's a really important thing for us to remember as we engage in this conversation. Now, another thing that I have to admit is that Senator Champion took all my questions. So instead, I just would like to kind of explain where my thinking is in some ways, and that the question of worker protections is incredibly important. And I know it's important to people who run restaurants. I worked in restaurants for 10 years, and I was lucky enough to work in a restaurant with an owner like Senator Drahan, someone who viewed that space, the hospitality industry, as a place of family. There's something about serving food and booze to people that I think makes you good to other people oftentimes. But those are small businesses. Not every business in Minnesota is a small business. We have large corporations who run restaurants and hospitality industry here too, where they might not have that same kind of relationship. And so I'm left with that fundamental concern. And the question that Senator Champion asked Senator Mathews, I think, is a very important one. It weighs heavily on me as we think about this. Where are the protections for people who aren't lucky enough to work with the fine people who are testifying before us? And that's something that influences me strongly as I think about this issue. And I guess that's my statement. Thanks.
Thank you, Senator Putnam. Senator Hurd.
Thank you, Mr. Chair, and also thank you to all the business and bars and restaurant owners that came to testify. I know this is a tough time for everybody, and including you. And it's good to hear your perspective. I am at the current time, I'm emotionally numb because of the people that I know close to me that passed away due to COVID-19, and these are majority of Black and brown, but not only Black and brown people. It's friends that you keep in touch with since high school. But I'm also most emotionally touched by the women in our workforce, as the testifier from the AFL-CIU mentioned the high percentage of Asian women, Somali women, Latino women, on our assembly line, and these are our mothers. Perhaps they don't go to restaurant, perhaps they do. But I would say, in many areas, if you bring people from many parts together at some location, perhaps could be restaurant, that could be a lead to the contract. I just want to state this point. And I felt, the restaurant owner, I felt what you're saying. I do have a lot of restaurant in my district, and all of our district have restaurant, and they are good as far as the current executive go with 50%, because I'm sure where we are, you have population density, and maybe they may have relative families like mine who passed away. So they are very, very cautious that take time, in due time. Right now, I think the people of Minnesota want us to guard for their health more, than I know the economy will come back in due time. We need to push things toward vaccination, and also, but I'm a little rambling right now, but I want to throw the question to Senator Mathews. Even though we already have executive order in place, it's hard to enforce. There's restaurants and bars out there that not follow the rules, and if we just base on good faith, how are we going to make sure that everybody are putting the right necessary information out there?
Senator Mathews.
Thank you, Mr. Chair, and thank you, Senator Hurd. I would say, and you raise a good point about some of the restaurants that seem to be operating just fine at the current restriction levels. And there's nothing that's in this bill that would stop a restaurant owner from just continuing with the same restrictions they have today. They can evaluate the needs of their workplace, the space they have, the community that they're in, and they can make those determinations. And it may look different in St. Paul, in your district, than it does up in Princeton, in my district. And we can account for that. And if a business owner says we'll leave it right at the way that it is, they've got the freedom to do so. I think to your question on enforcement and the issue with the how are people following the orders, I think the orders themselves have been a cause of a large of some size chunk of it, because people know that they are supposed to have laws that are passed through the legislature that are open to the public for opinions and comments and adjustments, and that everyone has their voice through their representative. And if a bill does get passed through that you don't agree with, but it's signed into law and it's the process, that's the way it is. And we adapt and we change and we follow the new law and move on. But we've had people react when it's just been executive orders that have just come from the executive branch. No opportunity for people to weigh in through their voice. So I think if we pass this bill, it will help alleviate that, because when a business sets their requirements and says this is how we need it done here in our jurisdiction, in our location, I've seen my experiences of overwhelming number of people will go along with that and will follow that. And when laws are passed through their constitutional means through the legislature, even if people don't like it, they go ahead and go along with that. But when we've had this system of executive orders, I think that has itself been the cause of some of the tempers and flare-ups. Heck, I just heard it this morning walking through a place down here in St. Paul, an argument going on at a place I was at earlier today, an argument going on over this. So I think that we would help alleviate that some of this tension and strife if we pass this bill that helps put it back in the legislature's hands and doesn't have it solely going through executive order.
Okay. I'm going to go ahead and start. And, you know, I'm going to, oh, Senator Hurd, did you have a follow-up?
Yes, I do, but slightly got a little confused here, and I lost my thoughts. But I appreciate Senator Mathews for the response. You know, what's the different? I know the issue. There's contrast different between the executive order and what you putting out there. Now, if this law has to, if this legislation pass, what pretty much there's no executive order if this legislation passed. Now, what discussion did you see will entail for us to talk more about it? And I'm on the same note, I'm even worried about other provision of executive order that might be impacted. For instance, the price gouging matters, you know, is because of the executive order that are put in place. But it appears not to be too critical or criticize this legislation, but without the executive, this open to all, meaning almost there's no law, there's no legislation. So I just want to state my point for now, and I'll stop. Thank you.
Thank you. Before I get started on my questions, I guess my first question would be to Mr. Chesak or any of the restaurateurs, if they would like to react to Senator Hurd's question around enforcement and his last comment. I saw a lot of reaction, so I'd like to offer you a chance to do that. And I see Mr. Harrington already raised his hand.
Well, thank you. What's more important than any of the governor's rules or the legislature is public opinion. customers are going to tell us when we're not following the rules, and we're going to get known for not following the rules. If that's the case, then we're going to lose customers. It's in our best interest as business owners to do the best thing and the best we can to make sure we're having a safe place for people to go in order to stay in business. That has more weight than any executive order or law. It's a big thing when customers have a perception of what you do and how you do it. That'll tell us how far we have to go and how well we have to make sure we're keeping everyone safe. Thank you.
Anybody else? Ms. Hummel-Fox. You're on mute, Ms. Hummel-Fox.
Sorry, thank you.
It happens all the time.
You know, I touched on this ever so briefly when I gave my statement, but now I have an opportunity to drill down a little bit more. When I said, let us be the protector of all the safety precautions, because what we have and what we do is absolutely incredible. In terms of what we do to keep our customers and our staff safe. We have a log where we have everybody take their temperature. They fill out a log every day when they come to work. If anybody has any symptoms whatsoever, everyone that worked that shift is now quarantined for 14 days. And so we've really gone above and beyond. But, you know, to Mr. Harrington's point, customers are not going to come to a restaurant where they don't feel safe and they don't feel comfortable. And since we've opened up, one of the comments that I've gotten from some of our guests is, thank you so much for making your restaurant a safe place. We feel comfortable coming there. And we really are the protectors in this industry. I just will say one other thing, though. When we talk about why we're here, and when the numbers that were being given from the state of Minnesota Health Department states that less than 1% of all positive cases can be traced back to a restaurant, it's mind-numbing that an entire industry would be shut down for less than 1% of positive cases. And to that point, since we did get shut down over the holidays, you know what happened? Everyone that would have been coming into a restaurant stayed home. They had large parties and large family gatherings, and there was spread that was born from that environment. Had the restaurants been able to stay open, we would have been socially distanced, or washing hands, wearing masks, sanitizing after every group was in. I think keeping us open would have been more beneficial to the positive case reaction than closing.
Thank you. Mr. Chesak, we'll take one last comment on this question. I have a couple more. So Mr. Chesak.
Chair Pratt, thank you so much. Chair Mathews, I had one question for you, if just a quick one. As I'm looking over the Senate File 1, and I haven't seen the delete all yet, but in the Senate file, Senator Mathews, does it state anything as far as getting rid of the preparedness plans or getting rid of all that? Or is all those things that we've been discussing from early on the pandemic, are those parameters going to stay in place?
Senator Mathews.
Mr. Chair and Mr. Chesak, the A4 amendment makes sure that all of those stay in place. Site-specific best practices, including but not limited to health and wellness, social distancing, cleaning, et cetera, a whole paragraph dedicated to it, yes.
Chair Pratt, Senator Mathews, thank you for answering. One more thing I wanted to say about Ms. Tapia that was on the line before. We just are working in the hospitality industry. So the industry that we're working in right now are the bars, restaurants that we're representing. And if all the parameters that have been put in place are going to stay in place, I just don't see how that could be a bad thing for our bar and restaurants to follow along with. Now, if everything was going to go away, we're going to get rid of all the EOs, everything, then I think we may have some bigger problems on our hands. But if everything is staying in place, but you're allowing a business to open up 100%, and to Mrs. Fox's point, public opinion is going to set the stage. We talked about that in all of our hospitality roundtable meetings from April to last week, about that's what's going to drive this whole thing. So if an operator is not doing it effectively enough, there are regulators on the street that are managing these behaviors. The customers are complaining on the hotlines that have been provided all across the state. And our folks are doing our darndest to make sure that we're following the mandates. Unsafe environment, we don't have customers. Safe environment, we've got customers. So that's what our folks have been trying to maintain. So Chair Pratt, thank you for your time. Thank you.
Thank you. I have just two more questions. And I'm going to direct this one to Mr. Huff. first. Assistant Commissioner Huff, a couple of our restaurateurs alluded to the fact that you were asking in contact tracing only about restaurants. I had a letter to the governor and I got a response, today. I got some of this information a little bit earlier. I haven't shared it with the whole committee. I was trying to get a complete response. But one of the things I noticed was that in your contact tracing questionnaire, you asked, and I can just go through this here real quick. But on the contact tracing for, shoot, I had something pop up that was in place from 9/16 to 11/11. You asked if somebody had been to a correctional facility, a homeless shelter, hospital or clinic, workplace, restaurant, bar, salon or spa, youth camp, school, university, childcare. For some reason on 11/11, you deleted all of those and only asked if they'd been to a bar or restaurant. Can you explain to me why MDH would make that change?
Mr. Chair, I am not aware of when that change was made or what precipitated that change. I'm more than happy to follow up with our team. I will say that in reference to our contact tracing, the purpose of contact tracing is for us to determine, are there other contacts that we need to reach out to? And what is happening in particular sectors that we might need to provide mitigation measures in. But the purpose of finding those cases, those contacts, is because that is how we slow the disease. That's the whole purpose of contact tracing. Where have people been? What has happened? Who has been exposed to a particular infected person? Our contact tracing questionnaire is based upon CDC guidance, and CDC provides us the guidance of what type of environments and what type of exposure should we expect. So, for example, I think one of the earlier testifiers alluded to concern that retail establishments were not included. In general, a retail interaction is passing. Now, we understand sometimes people will hang out and socialize in a setting there, but it's the same thing of like, we don't ask what you did when you were at the park.
Mr. Huff, we're running a little bit low on time here. And I'd like to at least stay on that rather than expand it to where you're going. But just a comment on your answer. It seems to me that when we're seeing infections, the number of infections go up, when we're seeing the infection rate increase, primarily due to community spread, it seems odd to me that the Department of Health would, in their contact tracing, reduce the questions of where someone might have contacted it in order to slow the spread and focus only on bars and restaurants. The actions of the department seem contradictory to your answer. And I guess that's the concern that I have, and I would be happy to allow you time to follow up and provide the committee the answer to that question. I'm talking specifically about the questionnaire that began on 9/16. You changed it. The one I received was dated 11/11, 1 week before the governor's executive order, and then it was all those other areas were added back in December, right before the executive order 103 was changed. To our restaurateurs and Mr. Chesnick, specifically those that are on the governor's roundtable, it seems to me that as was laid out earlier, you were given about 36 hours notice in March to close, and you were given 24 hours notice in March to close, and about 36 hours in November when you had stocked up your inventory for the holidays. And I guess my question is, if you're on the roundtable, is the governor seeking information from you, and is he taking that information around inventory and being able to mitigate? Because I've heard the governor say even on Sunday, he's trying to balance the economic and the health concerns, but yet when he gives you 36 hours, it doesn't seem like there's a lot of balance there. And maybe you can help me understand the conversation that's happening at the roundtable and the feedback and the information the governor is requesting in drafting his executive orders. And I'll just leave it open to anybody who's on the roundtable.
And I think Terry and I can agree. We had asked for 2 weeks to open, given the fact that we have to get staff back that have been furloughed, that may have taken another job, may not be living in the area any longer just because they're looking for other work. So we asked for 2 weeks, and then the 2 weeks went by. We asked for a week, and then the week went by, and then we just were expecting. We don't know when it's going to happen, and so you can't just turn these businesses on with a light switch and expect them to operate at any capacity percentage without inventory or any planning ahead of time. It's not like a shoe store. You can turn a light on and you still have shoes in the inventory. You have to order this product that is perishable, from your beer to your wine, and all that stuff is just pouring down the drain or thrown away. And some of our folks took it to homeless shelters or gave it to their employees that were completely broken out of work. So being at the roundtable still is a good thing for our industry to be part of the process. But the opening portion was extremely frustrating for our industry. And I think Terry can echo those thoughts as well.
Yes. Yes, thank you, Chairman, and giving me an opportunity to restate this again. But I want to go a little bit further than Tony just went, because when you shut us off within 48 hours, our refrigerators are packed with food. We've got liquor stacked up. And now liquor bills are due 30 days after they arrive, and we have no revenue. And we were all geared up for the holidays. That was devastating for a lot of people. As a matter of fact, a lot of people couldn't even open up when they were given the opportunity to do it because they had outstanding liquor bills and they were posted, so they couldn't get any deliveries in. Number two, in order for us to have carryout, so, we're closing for in-store dining, but you can do carryout. Do you know how long it takes to get a load of carryout containers to Minnesota? Because every single restaurant needs them, and there just isn't enough. And a lot of times they come from China. We have to wait 30 to 45 days for a container, so we couldn't even do carryout if we wanted to. And in terms of opening up again, and I was able to actually be on a call with the governor and ask him this question, but we need a runway. And typically 10 days is about as close as you're going to get. And you know why? Because none of the wholesalers have food in their warehouses. So even if we all open up, they still can't supply us. Or the guy from Pequot Lates who's doing, the organic duck and chickens. I mean, this all takes time. And we had to open up with less than 50% of our menu, 50% capacity. I mean, it's just so cumbersome. And my goal or my hope here with you passing this is that it's going to become less cumbersome, less restrictive, and we don't need an 8-page manual on how to have a private dinner or a social gathering. It's just too much.
Okay, thank you, Ms. Hummel-Fox. And, I think it's frustrating for me. I'm glad the governor's got the roundtable. I wish he would take some of your feedback as he's issuing these executive orders, because and what I've heard here today, before I go to Senator Mathews, I'd just like to maybe close up here, is this just isn't about business owners. I mean, you've all mentioned about your employees and your care for wanting them to be safe. We have the guidelines by the Department of Labor already that you have to have a COVID preparedness plan. And the guidelines are set for what should be in that plan. And I'll just say, personally, I worked with boutiques and restaurants in Prior Lake. We were going to set up a safe shopping zone. And amazingly, the plan that the business owners drafted were very close to what was required in the preparedness plans by the Department of Labor. So we just had to wait 6 weeks before that could actually happen. But like I said, this just isn't about the business owners. This is about the people that work for them. keeping them employed, keeping their families with the ability to pay the rent and buy food and hopefully put a little bit away for savings. And it's about helping the entire state start to recover from the recession that's been brought on. So Senator Mathews, I hope I didn't step on your toes. I'll give you just a couple of minutes for a closing statement.
Thank you, Mr. Chair, and thank you to all the committee members and all of our testifiers for a very thorough discussion on both sides of this issue, and I really appreciate that. I do want to close with making one final comment to assure the committee members on the comment about eliminating the executive orders. While my personal position is widely known about how I feel about the whole gamut of the executive orders, the scope of this bill in Senate File 1 is limited to the ones that have impacted the closure of businesses. And so the passage of this bill does not do away with the entire gamut of them. It is limited to the opening and closures of businesses. And so I believe that we need to keep changing the tools that we go about as we are trying to recover from this pandemic. And whether you like how last year played out or you don't, and there's not much positive to look back on last year, the past is in the past, and it's time to try doing better for the days, weeks, and months ahead in the future. And I think that this bill will be an excellent tool to try to accomplish that goal, to make sure that we do right by keeping this safe and secure for employees and for customers, and to make sure that we help our business owners be able to survive during this very difficult time. So I thank you, Mr. Chair, for this hearing, and I would ask members to please support Senate File 1. Thank you.
Thank you. Senator Draheim, would you move that Senate File 1 as amended be recommended to pass and re-referred to the Committee on State Government?
So moved, and I'd also ask for a roll call.
Thank you. Roll call has been requested. Roll call will be granted. I'll ask the clerk to take the roll.
Senator Pratt?
Aye.
Senator Pratt votes aye. Senator Housley?
Aye.
Senator Housley votes aye. Senator Champion?
No.
Senator Champion votes nay. Senator Draheim?
Aye.
Senator Draheim votes aye. Senator Putnam?
No.
Senator Putnam votes nay. Senator Rarick?
Aye.
Senator Rarick votes aye. Senator Herr? Nay. Senator Herr votes nay. The count is 4 yeses to 3 noes.
Okay, with the votes being 3 in favor of the motion, or I'm sorry, 4 in favor of the motion and 3 against, the motion prevails. Senate File 1 as amended will be sent to the Committee on State Government. I want to thank all of our testifiers and all of our members today for getting a little bit of a late start and going a little late. For those that in favor of the bill and against the bill, we appreciate your thoughts and your comments today. With that, members will stand adjourned to the call of the chair. I believe we'll be posting a meeting here soon for next Monday. So with that,
what I'm gonna do